Hello and welcome to The Truth Unfurled, the news channel that brings truth to you. Today we have with us Dr. Jeevan Singh Titiyal, who is an eminent and renowned eye surgeon, international fame with international repute, and he had been serving the All India Institute of Medical Sciences as chief of the RP Center for Ophthalmic Sciences. He has recently joined Dr. Agarwal's eye hospital and is serving here for the benefit of the poor people, for the general people, for everyone, and is taking care of all kinds of eye problems and ailments and is set to cure all diseases of eyes. Now we are here today with Dr. J.S. Titiyal to find out the real problems of eye that is going on today in this rainy season. As far as the rainy season is concerned, we can see a lot of conjunctivitis patients here, a lot of allergy problems. We would like to know from Dr. Titiyal as to what kind of issues that we are facing with conjunctivitis, with allergy. Why is it happening in the rainy season? How can we have the prevention from this disease? And how can we cure this disease? Sir, please enlighten us.
First of all, thank you so much for this interaction. I think it is very important to know, especially in northern India, there's a seasonal variation happening, every time. And every season gets you a new problem for the people who are living in this particular zone. If you look into eye condition wise, in this rainy season, conjunctivitis or eye flu is a very common phenomena. I can say phenomena because happening for so many years, and it is sort of a dreaded because it spreads so fast amongst the people, especially working group of people and children. And though it is a self-limiting disease, but it's causing so much of trauma to a person in terms of red eyes, the discharges, swelling in the eyelids. Sometimes it can disrupt your vision also. But looking into why it happens, I think because the rainy season, the droplets of rain, all the virus or a particle, they settle down little lower in the atmosphere, and that can hit you. And if you are in a crowded place, the infection spreads very fast. It spreads by touching.
Okay.
The virus cannot really hit you unless you touch your eyes with somebody infected. And people say if you see somebody with conjunctivitis, you can have a conjunctivitis. That is not true. That indirectly indicates like it is a very, very fast spreading virus. Like we had COVID. So it is like that only. It spreads by touching your mobile. You're touching your laptop, mobile phones, your clothes, your handkerchief. Those can be infected to other person also. So that is the reason it spreads so fast. Other important thing is it's a viral infection. The main culprit virus has been adenovirus of a different strains. And it happens every season, every year we pick up some different strains. And as I said in the beginning, it is a self-limiting disease. And if you don't do anything also, within 2 weeks, slowly its effect will go down. But yes, if you do a maltreatment, I say maltreatment because sometimes what happens, people go to a chemist shop, they can pick up drops there. And normally for red eye, people give you a steroid drops. And that steroid can decrease the inflammation very fast, but it can get you something more also. You can have other added infection, which can be bacterial, which can be fungal, or it can give you some other associated problems in the long run. The major advice from our side is, don't take medicine directly without the consultation of a physician or an ophthalmologist, because there are hundreds of causes for red eye. It can be conjunctivitis, we know that. One eye gets involved and within a few days other eye also gets involved. But they can be hidden causes of red eye also. Therefore, it is important to be to an ophthalmologist. He can or she can diagnose what type of red eye it is. Sometimes it can be infection, sometimes it can be inflammation. There you require a different treatment. So that's a precaution people have to take. The other important thing is what precaution we should do if you have a conjunctivitis. As I said in the beginning, you might, avoid going to your office or a school for a few days because you can be infected to other person. Second, keep your hands and your face clean, and keep your hands, every time you touch your face or eyes, wash your hands so that infection doesn't go to other person also. Keep your clothes, your towel, your handkerchief separately in one side, and don't keep touching the other eye also.
Okay.
So that is one important thing. And use of goggles. It has two important values. One, it protects from the light. Sometimes you can have a lot of light sensitivity to your eyes. That is called photophobia. Or it also prevents you touching physically to your eyes also. So both ways, the goggles are quite helpful in this particular stage. In fact, we have found, if you are wearing spectacles like you and me are using spectacles, we have lesser chances of having conjunctivitis.
Okay.
Because we are not touching our eyes directly with your hands. So that's one way is a protective for us also. The second important part is, sometimes this disease can have a slightly longer period of its, infectivity. And many people can develop complications also. It is mainly in terms of decrease in the vision. You start seeing a lot of halos sometimes, your vision goes down. That indicates your cornea can be affected by this virus. Normally it is the conjunctiva, the whitest part, which is affected. If your black part, that is cornea, gets affected, your vision can go down. You can have a painful eyes also. And sometimes there can be a small deposits on the corneal surface also. So that, if that happens, it takes very long time to get back to normal vision. And it is seen that if you do a conservative management, the chances of spot coming may be less. If you do an aggressive management, like I said in the beginning, if you use steroids, the acute phases control very fast, but this can come up subsequently. So this is basically the viral antigens and the antibody reaction which is getting deposited in the corneal surface. And you require anti-inflammatory drugs for a longer time also. So it is a simple disease, but sometimes it can be difficult also. Some people can have a super added infections, as I said, bacterial or fungal, then it damages your eye. So you should be very careful if you have, as I said in the beginning, photophobia, the disturbance in the vision, or your lids are getting too swollen, you see hazy vision, you should immediately rush to hospital to get checked and get a proper treatment for these cases also. And it happens in such a massive number in rainy season in the community, we call it an epidemic. So it is called epidemic keratoconjunctivitis. And this happens every year. Unfortunately, we can't prevent this because viruses are there in the atmosphere every time. When you get infected, especially when you have loads of virus, you rub your eyes, don't clean your hand, then you can have an infection also. The other thing which normally we like to help people is giving some sort of immune boosting in these cases. So if you keep yourself healthy, take some vitamins, especially vitamin C, that is helpful to a recovery faster. Or many people would say, okay, let's have a better food. Food is not going to help here, but hygiene is definitely going to help you in these cases also. So it is a massive seasonal variation which happens in the northern India. It happens in other parts of the country also, but more so in this part of our country because maybe we have more population here, more congestion, and 2 or 3 things we normally tell students or people who are very active in the swimming. So if you have a conjunctivitis,
Don't swim.
don't swim because you're going to infect other people also. Be careful. Sometimes swimming per se you might get an infection also. So if you are a regular swimmer, make sure you use the proper swimmer's goggles so that the water doesn't hit your eyes also. That precaution you have to take. As I said, office or school you can avoid for the first 2-3 days. Then you can go. If you are a patient, to make sure you don't get infected, especially if you have eye problems with you, like a glaucoma patients, or you recently undergone a cataract surgery. So better to be away from the crowded place at this season. And people who have conjunctivitis, they themselves should be, taking precaution for other people, like that we did in a COVID time also.
Yes, yes.
Like safeguard your own people. That only happens by safeguarding yourself first,
Yes.
So this seems to be a simple disease, but it affects a large number of people.
It can aggravate further if not managed properly in
Yes,
time.
correct.
Sir,
Absolutely correct.
as you said that people who go to the chemist shops and start taking steroids, that sometimes aggravates the problem and it may create some very serious issue also in the eye. So can we say that people should not take steroid unless and until they are not in consultation with an eye specialist?
Absolutely. I think, there should be a regulation from government or a drug controller of India. All the steroid drops, there should be a warning written. Should not be used without the consultation or without the prescription of ophthalmologist. So that will prevent a lot of complications happening with the steroids. One of the major long-term users of steroid drops are patients who have allergies. Because allergy, the treatment is steroid. But that is to control the active phase of inflammation or allergy. Then we have to replace that with other drops. So because this gives immediate relief, the person himself or herself or the parents, they keep giving steroid. And ultimately they develop glaucoma, cataract, which can damage their vision. So it's very, very, I think important to know that some drops can really cause, huge problem to yourself, and if you don't take a proper precaution. Not only for the conjunctivitis, I'm telling you regardless.
Otherwise also, yes.
Like for people who undergo surgery, like cataract surgery or laser surgeries, we give them just for 3 to 4 weeks. That were tapering doses, so they don't overload them with the steroids. And some people in population, suppose if I say myopic people, at least 10 to 15% people are there, they are steroid responders. Even a few drops of steroid can cause high pressure of our eyes, intraocular pressure. So that is a very significant point. Like in the population, we'll have around 10% people who may be responded to the steroids. Like a small amount of steroid can cause, complications to them. There'll be few people, nothing will happen to them. But it's better to take a precaution and take a guidance of an experienced ophthalmologist.
So steroids can cure some diseases, but it can be very dangerous also if not taken under medical consultation. Okay, sir, I would like to know that this conjunctivitis, have you ever come across people becoming blind and losing the vision permanently in this case?
Yes, this can happen rarely. I can say rarely, but in India, even it is a 0.001%. It's a huge number.
Yes.
Including the number of people suffering with conjunctivitis. So it should not be taken lightly. Don't sit at home, you have conjunctivitis. At least come once to show your ophthalmologist. He or she can guide you better. The blinding situation only comes when you have the infection happening with the viral conjunctivitis. That, as I said, as a bacterial infection, some bacteria getting into the the weak area of the eye, because once you have a conjunctivitis, your superficial layers are weaker. They can't defend themselves. So there, these bacteria or a fungus can get into your eyes, and that can be devastating sometimes, especially those people who have used steroids. Because one of the major causes for a fungal infection to happen in the normal tissue is the use of steroids.
Yes.
So if you have uncontrolled, unsupervised use of these medications, which weakens your local immunity, because eye, God has created eye like that, it is a self-sufficient in terms of managing itself.
Okay.
You don't have to wash your eye because there's a tear inside the eye. You blink often. It prevents anything getting inside the surface. It cleans every time.
Okay.
So that's a auto-regulation which God has made for us. It is only we damage the surface by getting into difficult situations, getting into crowded places, swimming in infected water, or damaging your eyes with the various things. We put water, we put so many preparation which we don't know what are those. In the name of getting clear vision or getting rid of various disorders. But taking so many tablets for various other causes, that can also decrease your immunity, and that can also cause complications in your eyes also. Like, people take steroid for other disorders like skin allergies, like you have various other autoimmune disorders, or you take various drugs for psychiatric drugs. They can deposit into the cornea, they can cause cataract. Similarly, some neurological drugs. So everything should be supervised. Like take tuberculosis drugs, they can affect eyes also. You can have a decreased vision. So this should be regulated. So this is a message for not only for people who are taking medication, for us also, for physicians also. Before we prescribe something for a patient, we should know what are the other side effects of this drug, and when should be controlled, when should we stop or taper that medication so that it doesn't have the counteraction onto the other important structure of the body.
Sir, now coming to the most important part of the interview, I would like Dr. Titiyal to let us know about Dr. Agarwal's eye hospital and why is it good for people to come here and what kind of good things are here, because as far as I know, I have seen Dr. Agarwal's eye hospital equipped with the latest technology equipments, latest physicians, all fully geared up for all kinds of treatment. The people here who are working as doctors and specialists are highly qualified, they are eminent people, they have all kinds of knowledge and experience. But we would like to certainly know from Dr. Titiyal as to what is very, very special that you joined this hospital and what makes people to come here and consult you for the eye problems.
If I look back on my decision per se, Dr. Agarwal's Eye Hospital is one of the leading chains of hospital in this country. In fact, they are in 10 more countries.
Yes.
In Africa and other places like Mauritius, other places, they have their own hospitals there. And I wanted some place where I can, give this expertise for some more years after, superannuating from AIIMS New Delhi. And I wanted some hospital which can be called Center for Excellence. And Dr. Agarwal's Eye Hospital has been known for, the creation of a facility which is going to take care of masses. I know that this is a profit-making organization, but still we think of poor patients also. So we have made sort of areas where we can manage poor patients also. And first thought in my mind was to have something which is nearer to the AIIMS. Second was to have a best possible facility, not for myself, for patients also. That means the area should be clean, it should be spacious, and the equipment should be the most ultra-modern possible. I gave this thought, and Dr. Agarwal's group of people, they agreed, okay, we'll place the best possible things in this particular hospital. And once you have a new and the highly specialized systems, your care to the patient also improves. And the faith and which patient come here knowing that it's a new hospital, everything will be new, but there will be experienced people serving this, and that is what the mixer I thought, and I could get that from this group of people. And second area was, this is the first hospital they are creating a NCR area. They have not come before. They are a south dominant group of hospitals. In north they have very few areas. So with this setup in Delhi, that to a place like South Extension Part 2, so we are hoping that we'll create the chains of hospital in northern India also, with possibly similar facilities and a more experienced people. Here we have all the departments of ophthalmic care, right from the most required area of cataract and refractive surgery to a corneal transplant facilities, which we are going to have very soon. We are awaiting the transplant registration from the government of India, from quota certification. Then we have a retina facility, every possible facilities here, pediatric facility, the ophthalmoplasty, tumor, glaucoma, The only thing we are missing is students here. So I'm planning very soon, we're going to have fellowship programs here. And if possible in future, we'll start a DNB in this particular area also. So this is going to be like an institute in future also, because we're going to have everything. Research is one area which Agarwals are taking in a very high level. And most people in a private sector don't think of research as a major component.
Yes.
But in Agarwal's, they have separate division for research, and they have the largest international collaboration now. And this particular center in New Delhi is going to be one of the important research hub in the future also.
Okay.
So that was my idea, what I was doing in AIIMS, education, patient care, and research. All three components are going to be here of a highest level. So that is what I thought maybe that will happen, and we can create this in the next 5 years.
Okay. So this was Dr. J.S. Titiyal, and I feel honored to talk to him because he is not only an eye surgeon, he is not only an eye specialist, but he is a recipient of several highly prestigious awards in the country, internationally, and is a recipient of the highest degree award, which is called Padma Shri from Government of India, which is a real feather on his hat. And we feel honored to talk to you, sir.
Yeah.
I'm really grateful that I had you gave me this opportunity to talk to you on this issue. I think most of the people would be enlightened by what Dr. Titiyal has explained about conjunctivitis, about allergies, and how to manage and how to consult physicians. And if you have any problem of eye, I am sure if you come to Dr. Agarwal's eye hospital, Dr. Titiyal is going to take care of you absolutely in a different way. You will not, because Dr. Titiyal is a patient-friendly doctor. I know him for many years now, and I'm sure you will be benefited. You should definitely try once Dr. Agarwal's eye hospital. Thank you very much, sir.
Thank you so much.
Thank you.
I appreciate